Hello, good morning, everyone. This is a new episode of Dr. Y. You know, some of the videos that I make are intended to help patients in terms of diabetes, nutrition, and other things, endocrinology pearls, if you will. But this video is on my series of efficiency for doctors and APPs. So the idea is that there is a lot of trouble with documentation on the electronic medical record. The electronic medical record is driving everybody crazy. And I think that we can help a great deal by showing you some of the documentation pearls on an EMR that will save you as a doctor or as an APP a ton of time that can be used for many other things that you need to do in life. And if I can make you happy and relaxed, then your patients also will be happy. So this is an indirect way for me to help your patients by helping you. Now, before we start, a couple of housekeeping issues. Please hit the like and subscribe button. These are at the bottom of your screen on the YouTube. Please do hit them now before we proceed. Thank you. Second thing I want to say is that if you want to thank me for this series, then you can donate to a charity, especially a food bank. If you have a local food bank, that is very much needed in this tough economic situation we're all facing right now. I'll also leave a couple of suggestions for charities in the comment section if you want to express any gratitude for the content you're receiving here for free. The other thing I want to say about this video before we start is I'm going to be sharing a lot of tips about documenting your note. Now, this is going to be on a ECW, which is one of the electronic medical records that's used out there. But don't worry if you are using another EMR or you're switching to another EMR. Don't worry, because the principles of documentation are going to be the same no matter what EMR you are using. And I'll do a couple of other videos in a similar fashion for Cerner, Epic, and other EMRs in the future, but the principle will stay the same. I'm going to be sharing about 20 tips for documentation of a note in clinic, and at the end of this video, I'll tell you what are the 5 biggest mistakes that you do that are costing you a lot of time for no good reason. So let's begin. All right, so this is a test patient. And the first thing I want you to see here is that the tip number 1 is that I'm using the web version of ECW. There is a web version, desktop version. You will notice this is much more aesthetically pleasing and looks much better. It has better functionality as well. So you always want to go with the thing that works best for you, and it's easier to navigate. The second tip I want to show you here is that before you even start with the note, you have to organize and coordinate with your medical assistant who rooms the patient for you, that the chief complaint section needs to be delegated to the medical assistant, where that is, they put in the reason for the visit, the main complaints, and also the main concern for the patient, or if the patient needs any refills, that also needs to be put in here. So delegate as much of the work as possible. Tip number 3, loading the template before you start. What is a template? A template is the skeleton of the note. The difference between template and a macro is that template is the skeleton of the note. It has multiple sections that are already filled out, that you fill out in anticipation that there are certain patterns or types of patients that you see. And, you know, they have their specific needs in the HPI, in the exam, and in the preventative medicine and so forth. So I have a bunch of templates, as you can see over here, and I'm going to choose the template for diabetes. This is for a new patient. So let's go here and pick this one up, type 2 diabetes. I'm going to just click arrow here and it will load up my template. As you can see, it loaded up things that I have had prepared for the HPI, for review of system, for the exam, for the assessment, and even preventative medicine. So it saves you a ton of time. Template is like the skeleton of the note, but if you want to flesh it out, you're going to use the macros. The macros are for specific sentences or paragraphs that address specific and certain concerns in any section of the note. We'll see that as we move along. All right, the tip number 4 is how you make your own life easier. Here, I'm going to give you tip 4 and 5. As you can see here in this section of the HPI, when I opened it, you have this arrow that actually is very helpful because when you press on it, it gives you a bigger section so you can see better. I also noticed that a lot of times your screen comes as a default, this screen that you click to open, whether it be HPI or any other section of the note, is small, and it's very hard for doctors to see what they are typing or what's going on. But that is a very easy adjustment to be done from the settings. You can go on settings here on the top left corner and change that to be the maximum, which the maximum they would allow is 70% of the screen. So you can go ahead and make that change, and as you log off the program and then log back on, it will be easy to see. So the arrow, don't forget, so that you can document easier. The tip number 5 is here I'm increasing the size, and some of you are saying, what is this? Is this a feature that is present on your computer, or what type of sorcery is this? But this is actually not magic at all or anything that is unusual. This is a standard option that comes on the Microsoft. And ECW uses that functionality that's present for you on Microsoft Windows. And the idea is you press on the control button, and with your mouse, you just roll the wheel, the middle wheel, on your mouse to enlarge the text or decrease the size of the text as you see fit. So make your own life easier with your documentation. Okay, the next tip is how to move in between sections of the note. So as you can see here in ECW, it's built in a way that is very similar to a house with multiple floors. So when I'm going to just close this out. When you go to the first floor, you see here, this is the first floor that has all the note sections of the chart displayed. But if you actually want to document in one of those sections, you click, and that takes you to the second floor, if you will, where you are now on the second floor in the room that is called HPI. That's how ECW is designed. Every EMR is designed a bit differently, but this is the thing with ECW. Then in order to move to the next note of, or next section of the chart, you can do it the easy way, or you can do it the hard way. And I bet most of you are doing it the hard way. So the hard way is to close this window, and then you want to go to review of system, for example. You would scroll down, go to review of system, click on review of system, then open it, and that takes a lot of time, and it makes you inefficient, lose a lot of time in the process. It's much easier to move in between sections of the note from this top panel here. So, and if you forget what these symbols are for, you can just click on them and it will tell you HPI. So just one click and you're back to HPI. That's a much easier way to navigate the second floor, instead of, so if you will, going down from the second floor to the first floor, then moving in the first floor, going up to the second floor in a different room. That is inefficient. The better way to do it is from this kind of strip on the top, you can just choose with what you want. So if I want to go to the assessment section, I will just click on this. It takes me to the assessment section. I want to go to the treatment section. Here you go, and so on. Back to HPI, much easier than the long way, the long, harder way. Okay, so we are now up to tip number 6. Let's see what happens if I have a return patient and I want to load a previous note from the last time I saw that patient. So the way to do it is I can go to template here, copy and merge from templates, and choose my last note for the patient, and just obviously I want to copy the template, meaning that I want to replace what I have right now with the template from the previous visit I had with the patient. And here you go. It loads up all the sections that I wanted to load up, that I designed for it to load up, which is HPI, review of systems, exam, assessment. Now, if some of these things are familiar to you, don't worry. I'm giving this talk to a mixed audience of people. Some are variable in how efficiently they use ECW or any electronic medical record for that matter. So, if you know the tip, that's great. But I bet you there are tips coming that you never heard about and that are very important, will save you a ton of time. Also, this is like drinking water from a fire hydrant, because there is a lot of information here, but you have it on video. So go ahead, and if you feel like you missed something, this is always going to be there on video on YouTube for you, so you can go back and look at the information again. All right, now we come to a very important point, which is on HPI. A lot of people do their HPI in this manner, all right, especially in the medical specialties, internal medicine field. There is this, like they start out here, for example, and then they start adding the date with a section of HPI that is added every time they see the patient. So this is the most recent visit now, and according to this manner of documentation, the person would write today's date and start documenting, what changes happened with the patient today. Now, this is a very inefficient way of doing things, and the way it is inefficient is because it renders your job in evaluating the patient before you go into the room take much longer and slows you down significantly for no good reason. All right. The better way to do it is to have a core sentence or a core paragraph about that represents the most important, essential, unchanging facts about this patient. So you have, for example, here, in March 23, 2020, which is probably the first time you saw this patient, you have documented patient comes in for a new patient visit for measurement of uncontrolled type 2 diabetes, diagnosed in 2005. Notice I said diagnosed in 2005, not diagnosed 15 years ago or whatever it is, because if it's in 2005, I don't have to edit this in the future. If I write a date here, that's not going to change. It's always going to be 2005. Versus if I'm going to, say 15 years ago, well, 15 years ago is different in 2020 than it is in 2025. It's going to be 20 years. So if you don't want to keep on editing, and you shouldn't, this kind of core paragraph about the patient, then just put in the date. And don't say, for example, the patient is, 71 or whatever it is, the age of the patient, because you have the age here. Why would you put here an information that you have to edit every single time you go in? Now, you want to have a core that doesn't change. The patient has type 2 diabetes. The complications are the following ones. That's not going to change. diabetic neuropathy, nephropathy, chronic kidney disease. The patient has dyslipidemia, hypertension, history of dietary non-compliance. So things that mostly don't change, that are stable, that you can just, depend on that as the core value for what you have that represents the most basic facts about this patient. Let's say the patient started on insulin. You can put here started insulin in 2012. Again, you're putting in a date. You're not saying started insulin 5 years ago. You're saying 2012. So that date is not going to change in the future. And then you have some other things that do change from visit to visit. So here he checks his blood sugar 3 times a day. Maybe at some other point, he's checking only once a day, or he finds a different set of results when he checks, or he has a problem with another of the medications that he uses. Now that part is going to be edited, and I encourage you to edit it every time, but the core set of facts about the patient should kind of remain relatively stable. But again, to my point about over documentation in HPI, which a lot of you do for no good reason, that takes you a lot of time, first of all, to do the documentation, but again, to read it back and kind of figure out what's happening with this patient. What do they have? Because you would have to read, if you've seen this patient for multiple years, then your HPI is going to be multiple pages. Are you going to read all of this to figure out what's going on with the patient? And why would you have information here that you're not going to read, or you might be missing at least some of it? Now, notice here also in this documentation, the last time the patient came, the patient has, a lot of us are trying to really do a good job with our patients, but we end up documenting things we shouldn't be documenting. So here you can see, for example, he says that his blood sugar and blood pressure have been higher or over the last 3 months because he got aggravated as he found peanut butter on his dog and came to the conclusion that his neighbor must have been the culprit, as he is known to love peanut butter and jelly set. Now, let me ask you, what are you doing? Why are you doing this? Now, I understand you're trying to be diligent and documenting everything that the patient is saying, but you really don't have to document this whole story or the question about the nutritional value of Cheetos or any of that. What you need to do is, if there is, for example, the patient says that they got stress and their blood sugar went up, just, patient states that blood sugar is higher because of social stress, period. That's it. So don't waste your time and don't add a lot of information here that you don't really need. That is one kind of, for you who use Dragon, which I see the value of, and it has a very good value, especially when you're dictating blocks of text, as in a new patient visit or a consultation. That is the main value of something like Dragon. But if you're using Dragon for everything, including a return visit, there is a trap that happens, which is that you get lulled into a false sense of efficiency, that you can be very efficient by dictating through Dragon. So you end up dictating a lot of things that you really shouldn't be dictating, and you end up losing time, even using Dragon, because you're putting in too many data that are not going to be important. So instead of all of this, here's what I suggest you would do. You just remove all of that, okay? Everything, all right? Including the dates. You just keep the core set of data, and then the paragraph, the second paragraph that tells you what changes with that patient, that is the one that you edit. So here is the first paragraph, which is the set fixed kind of core data paragraph. Then you have a second paragraph where you can edit to your liking. So let's say this time the patient checks his blood sugar, not 3 times a day, but 1 time a day. All right. You're editing. And as the patient is speaking and telling you, you're editing. All right. All right. And so on. This way, you're done with the HPI. It's much easier. And then you're moving on to other things in the chart. Okay, next. Remember, we're going to move in between sections of the chart here from the top. The next section, next thing that I want to go to is the before I move on to the next, to the review of system, I want to say also a couple of things, because the HPI is an important part of the chart. But I'm going to remind you about the importance of choosing either the clicking in between the options or free typing. I know that some of you choose one or the other, and this video is done for all specialties, and there is a wide variety of opinions about this, but I'm going to tell you the most efficient way. The most efficient way is, it depends on your specialty, really. If you are doing urgent care or something where you are seeing a basically well-defined kind of patients that you see time and time and time again, and that is the type of note that is amenable to the click type. What is the click type, you may ask? Is, there are some way on EMRs where you can have option patient, is complaining of pain on the, and then you have right side or left side. It is associated with, and you have like headache, nasal discharge, and so forth, and you click on those things. That type of documentation is very popular for computer people, for ECW or EMR designers. They really think that we as doctors and APPs use this type of template more than we actually do. And that's easy to understand, because they see the world through the lens of data that you have to just click and choose. But as doctors and APPs, mostly we deal with life as a story. So we prefer much to communicate by a block of text, unless your specialty is, for example, in urgent care, you see multiple cases of sinusitis, all right? Multiple cases of COVID, multiple cases of, kind of foreign object in the eye or something like this. So those cases are almost going to be identical. There are only differences, which side, what comes associated with it, and so forth. So that's the type of note that is amenable to the click pattern, where you have 2 or 3 options and you're just clicking on them to choose how your HPI is going to look like. But for most other specialties, including surgical specialties, it is easier to document in this kind of free typing kind of note. Also important to, and that is going to be tip number 10, is remember who you are documenting for. This applies to all sections of the notes. Who are you documenting for? Why are you doing the EMR documentation in the first place? You are doing it for 3 purposes. Number 1 is for care. You want to communicate the care, the thinking, the plan of action, what your thoughts are on the patient, to either a colleague who's a part of the network that is helping take care of that patient, or to even you, the future you. When you read back your notes, you want to figure out and remember quickly what's happening with this patient. Number two, you're documenting for the billing and coding purposes so that you can get paid for the note that you do. And three, for medical legal purposes. Now, contrary to the popular belief, a lot of people mistakenly think that for medical legal purposes, the more you document, the better. And that's not true, because there are things that you can put in that have absolutely no bearing on your medical legal standing. All they do is to delay you and to distract your attention from the things that actually do matter. So there are certain specific things like telling the patient about side effect of medication, when to come back to clinic, what kind of symptoms to be looking for, and so forth, that are very important medical legally, of course. But there are some other things like what you saw about the peanut butter on the dog that has absolutely no importance unless the patient, you get a sense that the patient is going to sue his neighbor for putting peanut butter on the dog, and in that case you need to document what he says. But anyway, because they may ask for the medical record. But anyway, you get the picture, I think. The next point is to use the macros, and this is really important, how to make technology work for you. There are a couple of ways that you can use the macros on ECW. There is a way that you can put it in, simply save it, design it, and then to recall it, you just type in the name of the macro or a shortcut and press Control space, and you got a sentence that placed over here. All right. I have a few of those that I've designed. You can design your own ones that would be helpful in documentation. So as you can see, by simply putting in the shortcut and then Control space, you're able to recall those macros. Another way of doing it is by this piece here, the three dots. You click on it, and then it has macros that you design that you can recall. I made a video about macros, actually several videos, so you can go back and watch that if you kind of want to remember. But this is the second way of recalling the macros from the three dots. You can just put in here, you click here, and it recalls the macro over here. All right. Okay, so we are done here. It's going to be much easier as we go, but those are certain principles that I thought would be very important for you to remember going forwards. So we are moving on now to the point number 12 about the review of system. So here you are, again, move from the top panel, you go to review of system by clicking here. And this is one of the things that wastes a tremendous amount of time for doctors and APPs. The way that most of us were taught in medical school to do the review of system is that you go system by system and you keep on writing, oh, general, I don't know what, patient denies this, lung disease, absent, indigestion, and so forth. That is a very inefficient way of doing it, and it's not required. Now let's go back to the three reasons why we document. We have to view everything in light of those three reasons. Number one, for communication of care. Okay, is that important? I'm not talking about the information. I'm talking about the way that you relay the information. Is this important to have it displayed in that manner, that you have like the list that has endless list that has 20 symptoms, yes or no, yes or no? Is that important? No, it's a total waste of your time. There is no reason for you to do that. The person who sees this note after you, they really honestly do not care. They want to know what's the deal with this patient. All right, they do not want to go over a list of 20 things that are present or not present, and then you have to go back and click change that in the future every single time you see the patient is just a huge waste of your time. There is no need for it from the patient care standpoint. It's much easier to go into review of system and let's say that, a patient has, he comes to see you for diabetes, but he has diarrhea. Okay. Is there any problem why you can't put this? Is there any reason why you can't put this in the HPI? No, there isn't. Just put it in the HPI. Yeah, I know in medical school, you were taught a lot of things about, it's not related to the main complaint, so you have to put it in HPI, but it just renders you inefficient. So with all our love and respect to the professors in like back in time who taught us to do it in this way, it's just not right. It's not worth it, and it's not right, and it doesn't add anything to patient care. Please do not do this. Please do not waste time in the review of system. Now, from the standpoint of the billing and coding, do you need to have an extensive review of system? You do not have to write it in that 20-point type of way. All you need is this statement. Other than what was mentioned in the history of the present illness, a thorough 11 system review of system was done and was negative. That's it. Now, do you have to type this every time? No, you don't. There is, again, I made a macro for that, and it should be a part of your template anyway. So you press on the 3 points here, boom, done. Why waste your time? Number 3, medical legal. Is there any problem not doing the 20-point kind of thing from the medical legal perspective? No, there isn't, because again, you're putting in all the information that you need to share in the note in the HPI. Let's say that the patient has diarrhea and nasal stuffiness, all right? There is no reason why you can't just put this in the HPI. And then your review of system will always say, other than what was mentioned in HPI, everything else is negative. That's it. So it doesn't have to go in a different section of the chart. Simplify your life. Life is hard enough. You don't have to make it harder for you by messing with that review of systems section, which I see happen all the time. It makes you very inefficient. You need to simplify your life. Okay. So there is no reason at all to kind of waste time on the ROS. All right. Anything that you need that is additional, you can put it in the HPI. So in that example, where the patient has diarrhea and nasal stuffiness, why do you have to say chest pain? No. And then every time you ask a question like this, you have to have the patient think about it, because the patient's thinking, well, if he's asking me this question, it must be important. So do you have earache? Yeah, sometimes, when I hit my head, or I sleep the wrong way. I mean, do you have pain in your skin? What do you mean? So see, this is a labyrinth from which there is no coming out. If you go in, you're never coming out. So don't go into that. Don't do that to yourself and to the patient. They are here for a reason. And if you're asking, ask the most relevant questions about review of system and about the main concern of the patient, and if there is something positive, document it in the HPI. Do not waste your time in the review of system. I say this mostly for my colleagues from the internal medicine, family medicine, and medical specialties. Do not waste your time into anything like that. Now, let's move on to the next section of the chart, which is the exam. Now, in the exam section, again, as a part of my template, I loaded up certain things that are considered normal, all right, that you do as a part of your exam every visit. If there is something that you don't do as a part of your exam, don't put it as a part of your template, but you put in as a part of your exam things that you check every time. And if there is something that is different, is changed, you need to edit and document. So let's say the patient has edema, you just edit and put in, but has edema. Right? That's it. You don't have to reinvent the wheel. Do not reinvent the wheel. Do not start from scratch. You have this loaded template. Use it to your advantage. Okay. The next part is the assessment. That's another important part where you lose a lot of time. And you also make mistakes by not including enough assessment. Now, I've talked a lot to my medical colleagues and people from internal medicine side of things. I want to now talk to my colleagues, the surgeons. One of your biggest problems why you're not getting the sufficient recognition and reimbursement for the things that you do is that you do not include this assessment, the things that you really are assessing and treating. An example of this is you're an orthopedic surgeon. Okay, you're seeing the patient for right knee pain. Okay, but you know the patient has diabetes, right? Now you're telling the patient in the visit, well, your blood sugar, I saw your hemoglobin A1C, it's way out of control. This is not good. We don't want to do surgery now because you're not going to heal well. All right. Well, what is that? What did you just do? That's patient care. You did patient care. But if you don't mention any of that in the assessment, you're not getting in the recognition for the work that you already did. It makes a big difference if you just include that assessment and have a macro, for example, in the treatment section that says, well, diabetes is out of control. We'll reach out to the patient's primary care physician to get a clearance and get the patient is advised to follow good nutritional recommendations and get the blood sugar under control, right? Yeah, that's an important piece of information that helps your patient and that you communicated that you need to get recognition for, because that assessment is very important. So instead of just writing right knee arthritis, you pick up, just put in the E11.65 for the uncontrolled diabetes. And then in the treatment section, you write what you addressed. And that's an important part in coding and billing that makes your note from level 3 to level 4 potentially, and makes a huge difference for, in general, for your reimbursement and getting what you deserve for the work that you have already performed. So this is an important thing. Now let's move on. So obviously in the assessment, you need to document all the things that you are addressing. So if you can be addressing them by continuing a medication, by refilling a medication, by giving nutritional recommendations, by reviewing a lab. There are multiple ways of addressing an assessment, okay? It doesn't have to be a new assessment for the patient, but you could be addressing it in multiple ways in the treatment section. If you are addressing it, you need to list it here so that you can get recognition for the thing that you do. Now, a lot of you are in that habit, forgive me, bad habit of documenting in the assessment. That's not a good way of doing it. And because it renders you inefficient. You would, a lot of you, what would do is they pull this assessment and they write on this here in this note section of it, what they think about this visit. That's not a good way for a variety of reasons. Number one, it carries through to the next visit, whether it's with you or with another physician using the same EMR. You don't want this to stick in the note. One of the good rules about carrying forward your documentation from previous visit, you do want to carry forward your documentation from HPI, from review of system, from exam. Don't forget to edit that, but you do not want to carry through your previous note from the treatment section. You don't want to carry through what specific plan documentation you did for this particular patient on this particular day. You don't want this to be a permanent part that you carry forward for every single subsequent visit. That's not good for patient care, for documentation, for medical legal purposes, not good. And it makes you inefficient as well, because now, you remember the analogy of the house of ECW being multiple floor house. Well, now you're like on the second floor going to the third floor every time. So you're on the second floor here, but every single time you have an assessment, you're going to the third floor. So here you're the third floor, the room of diabetes, right? Then you're going to go on the third floor for the hypertension and pull this out, and then that slows you down. You don't need to do that. So how do you deal with your plan, which is of course a very important part of the chart, is simply go to RX section and write everything you write in one place. I know, before you say it, I know, that's not how you were taught. I know. But I'm sorry, can you hear me out? The way you were taught is wrong. And we'll talk about it in just, let's just calm down and let's have a discussion about it, all right? Why do I see a lot of you do this, that you go to the section about type 2 diabetes, document, blah, blah, blah. Then this next number 2 section, blah, blah, blah. Number 3, blah, blah, blah. 4, blah, blah, blah. Why do you do that? Well, it's one of those things that you were taught to do in medical school. I bet by the same person who taught you to do the ROS in this horrible way in 20 points that completely are wasting your life, right? So, but what is the purpose of that? Is it important for patient care? No, it's not. Because you can put everything in the same section, okay? Is it good? Is it important for billing and coding? And I'll tell you, no. I know billers and coders will tell you, oh, no, you need to put everything under respective assessments. You have to do it that way. They are not telling you the truth. Some of them are not telling you the truth because they are convinced that the way to do it is you have to go under every respective item and type something. So if you have 20 assessments, you have to go under each assessment and type something, say something, even, oh, continue blood pressure medications. Then you go under dyslipidemia and say, well, continue statin. That's how they tell you. And some of them are genuinely convinced that this is the right way to do things because that's how they were taught. But actually, that's not correct from the billing or coding perspective. In billing and coding tests, and trust me, I know, they give you a block of text. You don't even have headings for HPI, exam, assessment, or plan. You have a block of text. I kid you not, one paragraph run without even punctuation. And they tell you, get the level of visit from that, right? And you can get a level 5 visit from a block of text like that without any heading. Not to mention the assessment and plan is not under respective headings. From a block of text, you can get a level 5 visit because it's the content of what you have. A good biller or coder will go, if you have mistakenly documented something that belongs in the treatment section, but you documented it in the HPI section, all right? A good biller or coder would go there and retrieve that information and say, well, this is a treatment. He did something for the patient, but he just put it in the wrong section of the chart. Doesn't matter. It doesn't matter what section you put it in. So that's a good biller or coder. Now, obviously, you want to be kind to your biller and coder. You want to make it as easy for them as possible, but not at the extent of your family, not at the extent of your sanity or your mental well-being or your health. I kid you not. If you're going to be losing so much time putting it in 20 different sections of the chart, just go into one section of the chart, right? The main assessment, and write everything you want there, okay? It makes it so much easier, less clicks, less going on. So here, again, remember what we talked about the assessment and how to use the macros for your own advantage. Here, I'm going to use a lot of macros. So I have macros that I've designed. They all start with the exclamation point. You design your own ones, right? So you can either click here and basically get all that good information, all right? You see how much information I'm putting? This is all things that I've done, but by a single click, I can get in a ton of information because a lot of what you do is repetitive. I can guess with certain level of certainty that you're going to see a patient with diabetes tomorrow, okay? So, there are certain things you always see, certain diagnoses you always see. So if you keep on, instead of reinventing the wheel and putting in every single time what you advise the patient on nutrition to do, just put it as a macro. With one click, you can get it. So I told you there are two ways of doing the macros here in ECW. There are different ways for different programs. Different programs call them different things. So for, Epic, that is a smart phrase or so forth. And for Cerner, there are certain ways of doing the macros. Every computer system has its own, but every computer system has a shortcut where you can put in paragraphs and important data that you repeatedly use in the form of a macro. Go back to watch my macro videos if you don't have that. But the first way here, I showed you that you can click off a menu that you made, or you can just put it in as a shortcut and boom, control space. You design it and then you put it with a control space here, and you have all the information that you need. Now, another thing that you do, so you discuss here, let's say you did diabetes, you did the blood pressure, you did something, talked about all of these things here, right? Now, and just you want to continue all other medications at the same dose, right? So just simply, you have a macro for that, and you say, otherwise continue all medications at the same dosage. Okay, now that sentence carries a lot of weight because it means you reviewed the medications from the medication section. You decided that the best course of action is to continue all of these medications, right? You don't have to go into the blood pressure section and say, well, continue blood pressure medications. And then you go into the statin, dyslipidemia section, continue statin medication. That is such a waste of time for no reason. You don't get anything of that. Your patients don't get anything of that. Maybe your note looks nicer, maybe, but is it worth it to waste, if you waste 5 minutes for every single patient that you see, and you have, I don't know, 5,000 or something patient encounters per year, how many minutes have you wasted? How much time did you, for what? So that the note would look better? I'm sorry, I'm trying to be a good friend here, okay? A good friend tells you what you need to hear, not what you want to hear necessarily. So if I'm, to determine what I need to put in, I have to go through those 3 screening criteria. Is it important for patient care? Is it important for billing and coding? Is it important for medical legal purposes? If the answer is no to all 3, do not waste your family time. Do not waste the time for your work outside of medicine, for your life outside of medicine, and do not waste the time for other patients as well who need you. They don't need you to document in a nice pattern. They need you to take care of them. Don't waste their time. Don't waste your life. All right. Okay. Yeah, it's a tough pill to swallow, and it may require you to change the way that you've been doing things for a long time. But I'll tell you, it's a bitter medicine. But some medicines are bitter. What can I say? All right. Now, next thing is the orders. Okay, the order section. Now, again, from the treatment section here, what you do is you go to orders, and one of the tips that I want to give you, tip number 17 or 16, is that you want to put favorites, and all EMRs have the same functionality, and that becomes much needed and so easy to use, and makes life so much easier for you if you are a surgeon or in a surgical specialty, because you have a certain number of procedures and of labs that you order, right? So when you go to labs, for example, you see here, I've made a lot of favorites. So you just click on this one and it becomes a favorite. If you have something that is not a favorite, you just click on the on this star next to it, becomes a part of your favorite. So I have a long list, because we order a lot of labs in endocrinology. So I have a long list of my favorites, but it makes it still easier to choose what I want to order for this patient. I can just go off this list and click here, click here, click here, click here, click here, and so on, and it becomes much easier to do. But there are even better. There are ways of bundling together orders, bundling labs, bundling radiology, bundling medications, and different systems call those bundles different things, right? So this here in ECW, the way that you bundle is something called order sets. Order set. Let's just move Dr. Yaqub here so that we can close this window. All right. So order sets here, see this thing called OS? I bet you've never looked into that. Well, these might be, you're switching to another EMR or something of that nature. And you might be saying, well, how comes that I've never heard of that? How comes I've never used this before? Well, anyway, don't give yourself a hard time. Whatever EMR you're using, it has that functionality. You just need to learn how to use it. Saves a lot of times. So order sets, I have order sets that are designed for every condition that I normally see. So for example, and I have them here under LCE. Yeah. So here, for example, for type 2 diabetes, I have one that you can simply click off a list. So you see, you can do medication. Obviously, you would have to go back and, like, after you choose everything you want off that menu, you go back and edit it to make sure that it is to your liking, duration, and everything. But you see, click the medications that you want to add, the labs that you want to add, the referrals you want to do, the follow-up, right? The information you want to give patient, all of that, and you simply apply it. All right. and then you're done. And then you're able, even you can put in, if you want, you can put in the note here. I don't do that. I just go back to my main section if I'm choosing the order set, and I'm going to just edit everything I chose and then send it off all together. You can also send as a comment send. Once you're ready from this button, that button sends everything, sends the order for labs, sends the medications, radiology orders, everything together. So again, a bundle is a way to save your time and make life easier for you. All right, we're getting closer to the end of this video. I want to keep my promise to you and give you a lot of the information about what are the 5 biggest mistakes that are ruining your life as an APP or as a physician. But let's move on to the final things. Is obviously after you're done with the note, you want to go to the next screen, next appointment screen, where you're putting in your level of visit, where you're putting in your follow-up duration, and finally you close. So now you're coming from the 2nd floor down to the 1st floor, and you're done with the documentation of the note. If you're evaluating what is a good EMR, and I've seen 20 of them or something, one of the features for all efficient EMRs is the option that says click and go, which means that it's like a 1-floor house rather than multiple floors. So you don't have to open a window within a window to get to something, right? You just click and go. It's called the click and go feature. And it kind of helps in a lot of ways, because you don't have to go through multiple levels and then close out of multiple windows. So that's in a way one of the weaknesses of ECW. And I'm trying to be charitable here to ECW, but that's one of the weaknesses that it has, is that multiple floors kind of functionality that it has. All right. So the last tip that I'm going to give you, tip number 20, is document in as few places of the chart as possible. It's much more clunky, much more inefficient if you go into every single part of the chart and document this, then close it out, then go to the next one and document that. What you really need is, you need to document in the HPI, okay, what's happening with your patient, okay? If there is something in the treatment section, sorry, in the exam section that changed from the previous visit, then you need to document that, okay? Many times there isn't, so you just leave it as it was. Let's say all the exam that you've done is normal. Well, your exam section says that the exam of the things you examined was normal. Why do you need to edit? You just bypass that section and go to the treatment section. It's the same assessments. Let's say you didn't add any new assessment. So then you only have to document in 2 sections of the chart, which is the HPI and the treatment section, right? And that's it. And then you close out the note. Now, and the note is ready. You try to do as much as you can in the room while you are with the patient. That's one of the most important rules for efficient documentation, because I know a lot of you, what they would think is, well, let me just go through the visit, and then when I go to my room, to my office, I'm going to use the dragon, use all of that in order to dictate and just finish up with the note. That's not a good idea for a variety of reasons. I'll tell you why. The thing is that documentation is like cancer. The note is like cancer. Would you say for about a patient. Well, let me deal with that cancer, 3 months from now, 4 months from now. Let me just deal with that cancer, when I get to it. No, you just, if you found cancer, you need to deal with it now, right? So the more you leave notes, the more it just becomes a mountain. Imagine you've seen 20 patients today and you documented nothing. At the end of the day, what is your feeling after you're drained, exhausted, and it's now 5 o'clock and you're worn out and you have 20 notes to document? It feels like an insurmountable mountain. It just feels like, this is the psychological burden of it is intense. It's painful. But if you're going through and documenting as much as you can while in the room with the patient, finishing, maybe there are a couple of things that you need to finish after the patient is the visit is done, out of the room, you can just tee them up and kind of close it. Or if you're rushed and you have several patients that you need to attend to, you just like 75%, 80% of the note is finished. You go see 2 or 3 patients. Then at, in between, while you have a 4th patient getting ready, you just lock and finish all the 3 notes that you've done. Then at the end of the day, life is so much easier. If you have, I have like 4 notes that are open that they are 80% complete, but 4 notes out of 20 are still open. I need to just tee them up or stuff like this. Life is much easier at 5 o'clock than it is, if you're just leaving everything till the end. So you have to finish as much as you can in between patient. And I'll give you another tip, a bonus tip, if you will, right? So, we said 20 tips. Let me just be generous and give you 21 tips. So the way I would do it, let's say you're seeing a new patient, there's a lot of information, and you really are not a fast typist. You can't really put in all of that important information in while you're with the patient in the room. You want to move on to helping the patient with the treatment section, so forth. And then, you say, okay, well, I'm going to finish that note whenever I get the chance in between patients or at the end of the day. Okay, right. Well, in that case, at least what you need to do is to put in things to remind yourself in the HPI section about what the patient told you, so that when you can look back at the end of the day, or maybe if you just didn't have any time to finish it today, tomorrow you want to finish up the note, you would remember what you talked about. And so you just like put in small things that would remind you. Let's say the patient, for example, had osteoporosis on a bone density in 2020. All right, so you say osteoporosis. You don't even have to write it the right way, in 2020. Then another thing is the patient went to the ER for hypertension, hypertension 2021, and so on. So now these are some very small things that make sense to you, okay? And don't take time to type. You just like do them while the patient is speaking. And then when you are done and want to now finish the note, you go back and look at this. Oh, okay. Oh, I remember now. Oh, okay. That helps to remind you of what was discussed during the visit. And so you can really write the note in the way that you want. Now, we are done. We are now going to go back and say, well, what are the 5 biggest mistakes? And I'm going to do them in descending order from mistake number 5, 4, 3, 2, and then 1. The mistake number 5 is the review of system. As I told you, review of system for a lot of us is such a waste of time. It's a time sucking machine that deprives you of personal time, deprives you of time that can be used for the most important valuable commodity is really time. You can make more money, you can't make more time. So you have to be very, very careful with what you spend your time on, right? So don't do this. Don't go and admits or denies. Please don't do that. That's awful. That wastes you so much time. All right. Just put in this clause, and anything that you want more than that, you just go into the HPI. All right. Now, the mistake number 4 is not utilizing the templates and macros and order sets and favorites, the technology that is available in every single EMR. It has those things. Now, the importance of them cannot be overstated. It's extremely important that you utilize those tools that are available there for you. Okay, and we saw how you can save a ton of time by going into the treatment section, HPI section, and using a lot of those shortcuts, right? And spend time, think of what you advise patients the most, and you're going to be able to save a lot of time, because a lot of what you do it over and over and over again, so you don't have to reinvent the wheel. Mistake number 3 is the HPI. Lots and lots of people, especially in medical specialties, waste a tremendous amount of time in the HPI, and they make it too long and it becomes unreadable. It takes you on the next visit to get ready to see the patient a ton of time that you don't need to be wasting. Mistake number 2 is in the assessment section. That in the assessment section, that's mostly a mistake of surgical colleagues, that they don't pick the assessments that they have addressed and that they are actively working on with the patient, even though those assessments are important for documentation, for patient care, for medical legal purposes, for billing and coding, extremely important. So please document those assessments. They make a huge difference. They don't take much time from you. And remember that whenever you are addressing something, you don't have to be prescribing a medication for it. If you tell a patient, get your blood pressure in order, your blood pressure is too high, it's not safe for me to do surgery on you, that is a way of you addressing something. And by the way, it helps your patients because maybe they weren't aware of that. And you're drawing their attention to something that is going to save their lives. Forget about their need for this for now. You're going to be saving their life because you're telling them this blood pressure will give you a stroke. Okay, what is that? That's medical information. That is, you're drawing the attention of your patient to something. You don't have to prescribe a blood pressure medication, for heaven's sake. But just by documenting this hypertension, just don't eat as much salt, talk to your doctor, take your medication on time. All of that is medical information that you are doing. You have to take credit for that. Why do you do a lot of good stuff that you don't take credit for? All right, enough of belaboring this point. The biggest problem, the biggest issue where people waste time, that is wasting your time and ruining your life, is the treatment section. All right, do not do this thing where you're putting in 20 assessments and under every assessment you feel like you have to write something. That is a total waste of your life. Don't waste your life. All right, do it in this way, like I just showed you under one of them. Yes, the note may not be to your liking. I don't know. Maybe you'll get used to it after a while and you'll start to oh, it looks beautiful to me, but it might not initially be what you're used to, seeing 20 points and under each one of the 20s has something written down, but it's going to be so much more efficient and doesn't sacrifice anything, doesn't sacrifice patient care, it doesn't sacrifice billing, it doesn't sacrifice the medical legal aspect of things. It doesn't sacrifice any of that. You just write everything in one place and save your time. I hope this has been helpful for you. I hope that will be better users of EMR for our own sake and sanity. And let me tell you before I let you go, is that I know a lot of you feel under a lot of stress by administrations for locking your note or signing your note or finishing your note. Okay, I want to invite you to think of this in a different way. Of course, administrations will always want you to do that because they can't bill for the notes unless they are completed and signed and locked. But I don't want you to think of it as, oh, this is something that just administration wants me to do for their own benefit or whatnot. No, from the standpoint of your own sanity, you really want to lock the notes or sign the notes, whatever your EMR phrase is for that, as soon as possible. The reason is for your own sanity, because the note documentation, as I said, is like cancer. The time that it takes to finish a note dilates. If you're now with the patient in the room and you're finishing up everything as quickly as you can finish the note in less than 3 or 4 minutes. Okay. If you leave it to the end of the day, it's going to take 10 to 15 minutes. If you leave it for the next week, it's going to be 20 to 30 minutes for each single note, because you have to look back and think, you have to redo the visit in a way in your mind if you're going to do it a week from now. That is just too much wasted time. Please don't waste your life. Blessings to everybody. There is this some charities if you want to donate to them. And until the next episode, I say goodbye and have a great day.